Healthcare that saves the day.
Hey everyone, welcome back to Healthcare That Saves the Day. We're thrilled to have you here. Did you know that the United States spends more on healthcare per person than any other country, yet still struggles with providing adequate access for all?
That's mind-boggling, isn't it? We're diving into a huge topic today that impacts practically every American family, the cost and access to healthcare. It's an elephant in the room that we can't afford to ignore any longer.
Exactly, Joe. Millions are facing challenges in getting the care they urgently need. It's heartbreaking to see people delay or even skip treatments because of financial constraints. Can you imagine not being able to get essential care?
Absolutely, and it doesn't stop there. There's also a significant number of folks who can't afford their prescriptions or don't have a regular primary care provider. It's almost as if the system is set up to be a maze with no clear way through.
Let's break this down, starting with why costs are so high. Subtopic 1 is all about understanding these financial pressures. For instance, administrative costs account for a whopping 25% of the total healthcare expenditure. That's not just the doctors and nurses, it's paperwork, billing, insurance claims. It's a huge drain on resources.
And that's exactly why something as basic as going to a healthcare provider has become so complicated and costly. People find themselves trapped in red tape, and the fallout is severe.
Totally agree. The ripple effects are widespread. For example, if it's a choice between rent or a doctor's visit, what do you think people will prioritize? It's a no-brainer.
You're right. That's the harsh reality. To tackle this, we need to dive into innovative solutions. Like telemedicine, it's a growing trend that's making waves by offering convenient, affordable care, particularly for those in remote areas.
Telemedicine is a game changer. It reduces overhead costs for providers and for consumers. It means no travel time, fewer missed appointments, and making healthcare more attainable.
And that brings us to other subtopics like the importance of preventive care. Judy, multiple studies show that preventive services can save thousands of lives each year and billions in economic costs that come from untreated conditions.
Prevention over treatment. It's common sense, yet so many avoid regular checkups due to cost or they simply don't see a doctor until they're really sick.
This is why public education campaigns are crucial in spreading awareness about how affordable preventive steps can actually be.
Indeed. Plus, if you factor in lifestyle changes and community support systems, we're talking about a more holistic approach to healthcare.
Now, speaking of community, local support networks can play a pivotal role. Community health centers, for example, are doing phenomenal work for underinsured populations. They create accessible points of care that act as a safety net.
Community is key. And these centers not only offer medical services, but also help with health education and lifestyle management, which ultimately cuts down the overall healthcare costs.
Let's wrap up by summarizing what we've discussed. Healthcare should be seen as an investment in our well-being rather than a burden.
Precisely, and if we want to see any real change, it requires everyone from individuals to policymakers to emphasize affordability, accessibility, and education.
Thanks for tuning in today. As we navigate our healthcare system, let's strive for a model that truly saves the day for every American.
We challenge our listeners to consider what they can do to advocate for reforms in their community. Let's be proactive and ask, what steps can we take today that our future selves will thank us for?
Couldn't have said it better, Judy. That's a wrap for today's episode of Healthcare That Saves the Day. Until next time, stay informed and stay healthy.